see some voluntary muscles and involuntary muscles. And now this is your curriculum. Of course, everything is not A16 point, this thing is not the, you have to, only this will be in your medical career. But it is the program made by the MCI and this thing, NMC, that you have to be focused in these areas. Okay? Now, describe and identify various types of muscles under the microscope. Classify muscles and describe the structure and function correlation of the same. Describe the ultrastructure of muscular tissue. Now the property of contractility is well developed in muscular tissue, contracts. Even when you go, have you seen, you go to the poultry shop or mutton shop, after the butcher cuts off the neck, you see again peel off the skin, but yet the muscles are twitching. So it contracts, okay. Now myocytes, muscle fibers of muscular tissue. Myocytes are the muscular tissue. Muscles are derived from mesoderm. Now ectoderm, endoderm, mesoderm I told you earlier. So muscles are developed from the mesoderm. In muscles, sacrolemma is plasma membrane, sacroplasm is cytoplasm. Sacros means flesh and plasma, thing in Greek. Sacroplasmic reticulum is endoplasmic reticulum and sacrosome is mitochondria. You have viewed a cell under the microscope, you get the mitochondria, then your endoplasmic reticulum. Now this next. Now histologically the muscles are classified into 3 groups. Now this is a question often asked in Viva. Okay, Viva literally in the histology, when you are doing you are viewing the slides, you just put it in your notebook. The skeletal muscle, cardiac muscle and smooth muscle. Now skeletal, the name itself, the muscle which is attached to the skeleton of the body. That is skeletal muscle. The cardiac muscle, the muscle of the heart. Okay. Now physiologically, muscles are classified under voluntary skeletal muscles under control of our will. Involuntary, cardiac and smooth muscles not under our control. So the heart, the muscle, the contracting, it is not, I mean, I stop my breath and literally try that, let the heart stop for 1 minute or 5 minutes. I cannot control it. Okay. Now, the voluntary muscles, the skeletal muscles. If I want to hit this guy, now I'll to hit this guy. This is under my control. But if I just want to stand like this, bhalo chele, ekটু দাঁড়িয়ে আছি, এরকম করে দাঁড়িয়ে আছি, আমার all movements and muscles are under my control, my will. That is your voluntary muscles. Now skeletal muscles, also called striated muscles, because of striation, voluntary muscles are under will. Now because of skeletal attachment responsible for locomotion, visceral striatal muscles, microscopically identical to the skeletal muscles, confined to the viscera such as tongue, pharynx, peripheral part of the diaphragm and 2/3 of the esophagus. Now visceral. Now these visceral muscles, that is the tongue, pharynx, peripheral part of the diaphragm and upper 2/3 of the esophagus, involved in speech, breathing, swallowing and coughing. This is and microscopically identical with visceral striated muscle, and because of skeletal attachment responsible for locomotion. Now, this is again this part, visceral striated muscle, microscopically identical to the skeletal muscle, confined to the viscera such as tongue, pharynx, peripheral part of the diaphragm, and upper 2/3 of the esophagus. This comes in viva. Involved in speech, breathing, swallowing, and coughing. Now, histology of the skeletal muscle. Now, identification with features. Skeletal muscle fiber is a multinucleated the nucleus. These are the fibers. Okay. Now, of varied length. Each muscle fiber is elongated, unbranched cell. It's an unbranched cell. The nucleus is there. Now, nuclei are flat and located in the periphery of the cell, just beneath the sacrolemma. Now, this is another photomicrograph of skeletal muscles. Muscle fiber multinucleated, muscle fascicle, and see the muscle striations. This is 100x, this is 1000x, and this is 400x. Anyway, you see between these two in your microscope, 100x and your 400x. Now, histology of skeletal muscle. Now, fiber shows transverse striations of alternate dark and light bands. Dark band is called A and light band is called isotropic, and becomes because of their power of refract light in polarized microscope. Now, this you have to see it in under polarizing microscope. And polarized microscope is a special microscope. And the connective tissue of skeletal muscles are endomysium. Endomysium is a layer of reticular fibers. Perimysium covers a bundle of muscle fascicles. Epimysium covers the entire skeletal muscle. Now, ultrastructure of skeletal muscle. This you have to go and read and see your sacroiliac reticulum. Now, these are the difference between fibers of white fibers and this thing. Nerve supply of skeletal muscle, the motor end plate, muscle spindle, motor unit. This will be taught in physiology. Okay. And also when you are reading anatomy, you will be seeing the things. Now, this is the muscle spindle. That can be a short note or 10 marks. Okay. And this related to the action and the of the muscle, the neuromuscular junction, motor end plate. Now, this is the cardiac muscles. Now, cardiac muscle fibers are located in the heart. They show following peculiarities: autorhythmicity, contract on their own without any stimulation, hence it can work as a pacemaker. Show cytoplasmic striations supplied by autonomic nerves, sympathetics and parasympathetics. When you read neuroanatomy and your physiology, the sympathetic control and the parasympathetic control. Cardiac myocytes are connected with each other by densely staining bands called intercalated disc. Cardiac muscle also shows striations, but it is involuntary in action, striated involuntary. Cardiac muscle shows less number of myofibrils than skeletal fibrils, hence striations are less prominent in cardiac muscle. The difference between the cardiac muscles and the skeletal muscles is the striations. The cardiac muscle is having less striations than your muscle fibers. Okay. Now, cardiac muscle fiber accommodates more amount of sarcoplasm and mitochondria. Now, mitochondria is a powerhouse. So, heart is always beating, always beating, always beating. From the day when in the spermatozoa and the ovum fused, then the fertilization took place, then the embryo, the process of embryogenesis. You will be knowing the development at what stage of the heart. It's a tube, it's a small tube like this. Then it goes and modifies according to the organogenesis and the process of growth of an embryo. Now, if you take a very high resolution ultrasonography, then in the earlier stage you will see a gestational sac and a small this thing, but there is no pulsation within 6 weeks or something like that. If a woman comes with a spotting after getting pregnant, at 6 weeks or 8 weeks, she comes with a spotting, then you immediately go for an USG. Now, when you do an USG, then the report comes missed abortion, or the sonologist suggests that you repeat the USG after 2 weeks or 3 weeks. And you, by the time being a gynecologist or a general physician, wherever you are located according to the facilities available to you, you will suggest that you take complete rest. There are some medicines you give and some hormones are there. You have to give complete rest and this thing. And then after that thing, again you see if there's no cardiac pulsation in the embryo, small, whatever it is, then you suggest that you have to go for an dilatation and curettage. You have to abort this because it won't stay. But yet, some doctors, even the request of the ডাক্তারবাবু এটা বাঁচাতে পারবেন না, একটু চেষ্টা করুন, আমাদের 5 বছর পরে হয়েছে বাচ্চাটা. Now, in between these two, it's a big dilemma. But if your experience, you will say, oh, no, this won't stay. Even if it because the pulsation is not there, it cannot regain the pulsation. Bleeding has stopped. So be bold enough, but you don't, when there is a question, big question, and the couple does not want to abort, don't try to persuade or don't force that couple, because you just suggest, you take another opinion, you send it to some senior gynecologist or your teacher or your friend, and then they will go, whatever happens, they will settle with them. Again, if this couple goes there, if your teacher, like Arup Maji sir is a senior gynecologist professor. He is the author of multiple books in gynae obstetrics. He is a wonderful teacher. So if you send him, then if they hear the same echoes, the same words, then Baba, eta theek mein na. Then what happens? Whatever situations this couple comes into, in the later stage of future, they will come to you. So your job is to diagnose, to know what is what, and give a good consultation. Okay? Now what we'll do, now see histology of cardiac muscle, a long thick branching muscle, the long branching, like you can now differ the muscle, the voluntary muscle from the cardiac muscle. Involuntary, see, cardiac myocytes are joined with each other by intercalated disc. These are the intercalated discs. Now each cardiac myocyte measures about 50 to 100 micrometer in length and about 15 micrometer in thickness. Each cardiac myocyte has a single centrally placed large oval nucleus. Here. See, this is the state of affairs under the microscope. That was the diagrammatic picture of the that which you will draw in your histology lab book. The previous picture, I will just go back. This but this is a thing you will view under the microscope, and that is for your exam. This is for your exam, and that is for your lab book. And this plus for your studies, how the cardiac muscle, short note on cardiac muscle. Okay. Intercarotid disc. Now smooth muscles. Now smooth muscles are non-striated, involuntary muscles. Now smooth muscle cells contain actin and myosin filaments. These filaments are not arranged in orderly manner, unlike skeletal muscles. Hence, smooth muscles do not show cross striation. Supplied by autonomic nerves, sympathetic and parasympathetic. Adjacent smooth muscle cells are connected with gap junction. It helps in simultaneous contraction of adjacent cells. Viva. Again, smooth muscle cells do not have T tubules. MCQ. This is C. Smooth muscle cells do not have T tubules. Location: wall of gastrointestinal tract, blood vessels, respiratory tract, urinary tract, erector pili muscle. Now, we'll show you the smooth muscles in the gastrointestinal tract, ileum, everything, and non-striated involuntary muscle. Histology of the smooth muscles, you can see longitudinal spindle-shaped shields, dark eosinophilic because of myofilaments. These are the smooth muscles. See, these are schematic, diagrammatic figure, and these are the cross transverse section, how the muscle looks, and these are the longitudinal section. Okay. Now this is the picture of smooth muscles, longitudinal section, circular layers, transverse section. This is in 100x, this is in 400x, this is in oil emulsion 1000x, light striated nuclei. Anyway, now you have to come down just in group. There are 7 slides. তো 7 জন চলে যাও, দেখে নাও, আমি আছি। চলো 7 জন করে আবার 7 জন দেখো, বসো, খাতা দেখো, যা করবে করো। Hey, you take your notebook. এটা you just write, draw, whatever it is, you take a note. আমি দেখো। দেখো, you're seeing it in the microscope. See, cardiac muscle you see here. হ্যাঁ, এটা তোমার cardiac muscle. দেখো, এটা you adjust accordingly. এরকম। Now fine adjustment is here. And you, what I want to say, দেখো ওখানে ইলিয়ামটা খুব ভালো আছে, দেখো। এটা ইলিয়াম বোধহয়, হ্যাঁ, ধরো। একটু লো লাইটটা দেখো, তাহলে তো জুম নিউক্লিয়াসগুলো মানে একবারে ইয়ে হয়ে যাচ্ছে, and you see the muscles. এরকম এগুলো সব epithelium with mucous glands and all this. Okay, now the muscles are here. আবার এরকম। Now what I want to say is that you have the diagram, and now these muscles are here. It is involuntary. Now the thing, it is not under your control. Okay. Now you just draw this. Now this is a smooth muscle. And involuntary. ঠিক আছে? And your now the next step, you see the cardiac muscle. এরকম draw, and when you go, you see the histology textbook, you have to take the notes.